So I am super fortunate to be talking with Diane here, who just completed the 3-month program for knee pain. And well, I just want to let you take over, Diane. Can you tell us what that knee was like before starting the program?
It hurt. You couldn't bend down. I mean, anything I did, it just really hurt. And I went try to get a shot. They said that if it didn't work, I'd have to have surgery. I said no. I had to find an alternative. So I came here. And I found a great alternative. Now my knee feels great. I can do things that I normally wouldn't have to do, normally couldn't do, and I don't have to have surgery. I don't want to have surgery.
Tell me about some of those things that you couldn't do and now you're able to do.
Bend down without
Yeah.
pain. I can walk better. I mean, I have noticed a lot of difference just walking.
There's 2 other things, and I'm gonna ask you to share those. But
Okay.
what else did you notice in this program?
The weight loss.
Yeah.
The weight loss. I've lost a lot of weight. I work at Giant. Everybody knows me there. They come in, they'll go, "What'd you do? Were you okay?" I was like, "I'm fine," but it works. It works.
Do you care to share how many pounds in 3 months that you lost?
My poundage is yours. Because I have, according to my records, I've lost 35 pounds. And I'm
Okay.
happy about that.
You
Good.
lost 35 pounds in 3 months.
Mhm.
Now, honestly, people watching this may have a hard time believing that, and a lot of them are like, "Oh, that's not
No.
healthy." How did you feel during this loss of 35 pounds?
I feel great.
Yeah.
I wasn't hungry.
Mhm.
I ate a lot of healthy things.
Perfect.
And it's, the shakes are great. I mean, it's wonderful. I mean, I was really surprised. I was skeptical when I first started. I'm like,
Yeah.
there's no way. But when the pounds started coming off, I was like, oh. Wow. And then when people actually started noticing it,
That was big.
yeah.
Now, this is going to sound like a commercial for Giant, but at Giant, you guys have food up there that would fit into our program?
We have salads.
Yeah.
We have salads.
Yeah, you
So
have an
there's-
organic section.
Mhm.
Okay, there's a lot of good stuff in organic
Yeah,
section.
And they've got the paleo. They have some paleo
They
products.
do.
Yeah,
They
they have
do.
that Mikey's now.
Yeah.
I don't know whether you've ever had that.
I don't think I have.
It's Mikey's. It's a muffin top. It's actually really good. It's actually really good. It's double chocolate.
Does that really fit into my program?
Yes.
Okay, I'm gonna have to look at this muffin
Yes.
top. I'm gonna look that up.
You look it up. It's Mikey's.
But here's what I want the listener to get. That sometimes they think they gotta go to the local farmer, or they gotta shop all at Whole Foods, and that's really expensive. So you probably do a lot of your shopping at Giant, and you're able to get a lot of the food
shopping
there.
at Giant and Walmart.
And Walmart. And so you have to be selective with the aisles you push your cart down, but it can be done at Walmart and Giant.
You get it in Martin's. Any of the grocery stores.
Perfect.
I don't shop. I shop at Martin's and I shop at Kroger. I mean, not
Yep.
Kroger's. I shop at Giant and Walmart.
And you did it. And you weren't hungry, and the shakes and all that was okay.
Yeah.
Good.
It works. If you stick to it like you're supposed to, it will work. And you lose the weight, because the weight doesn't help you at all. I mean, it's pressure no matter what.
Yeah.
But if you stick to it, it works 100%. I'm off on my blood pressure. I lost the weight, went to the doctor. He's like, "No, let's take you off." So I have no medicine at all, which is great.
That is phenomenal. Put her there. Patient of the month right here. And here's the thing, I'll turn it to me. The thing is that we work hard here, but this is the worker right here. So Diane really gets the credit there, because it's work, right? It
It
takes
is.
work. If
It
you
is.
want to change, you have to change,
Yes,
right?
Yes.
So you put the effort in and you get the results.
yes.
Thanks for doing this for us.
You're welcome.